The director of the Oregon Health Authority says our healthcare system is on the brink of collapse in many areas of Oregon. And tonight we're getting an inside look at what local hospitals are facing. We took a tour of the intensive care unit at OHSU. As more people are hospitalized with COVID, nurses are bearing the weight of caring for them, and it is taking a toll. Fox 12's Drew Marine heard from some of those nurses and shares their message.
Nurses here at OHSU have been hard at work taking care of COVID patients over the last year and a half. They say they've seen many preventable deaths and hope getting a closer look at how scary this virus can be will be a wake-up call for more people to get vaccinated.
It's devastating. It's really heartbreaking knowing that people are fighting for their lives, and it could have been prevented.
Day in and day out for more than a year now, ICU nurses have been working on the front lines of the COVID-19 pandemic, and for many, it's taken quite the emotional toll.
To be in that isolated room with your patient who's super sick that you're doing everything you can for, but it's just a really tough scenario.
Walking through the halls of the OHSU ICU, nurses suit up to take care of COVID patients, many of whom aren't vaccinated. Friday, OHSU reporting 37 people are hospitalized with the virus between their main campus and their Hillsborough Medical Center. 21 of those patients are in the ICU, and only one of them is fully vaccinated. The rest, unvaccinated. ICU nurse Sarah Mo Mukami says seeing COVID and vaccinations particularly be politicized is tough, especially because this virus doesn't discriminate. One nurse saying patients' ages range from their 20s through their 50s.
It's frustrating because I think people have this kind of me complex or me syndrome, that it's not going to happen to me, it's not going to happen to me, it's not going to happen to me, and it's happening to people. But it's hard not to feel like this is the epitome of privilege, right? And in this country, we have the privilege to get this vaccine. And globally, people would do anything for this vaccine, and they don't even get this chance.
She says she understands why people might not want to hear the reality of the dire situation in local hospitals because it's terrifying.
People are sedated because they're intubated, so they have a breathing tube down their throat, right? And so then to make them comfortable, we have to put them on medication to make them comfortable. That has a slew of side effects. The reality is they're all unvaccinated. The reality is a lot of them will die. And if they don't die, they have unrepairable damage to their lungs. Their lives will be forever changed.
OHSU is so overwhelmed with COVID patients right now. ICU nurse Julie Cleese says not only is it impacting the Portland area, but rural communities too.
When our rural communities are suffering, they're sending some of their sickest patients to us, not to mention the rest of the community is still suffering from other diseases, so we are stretched to the max. We have the most COVID we've ever had. Our rural partners are struggling. They're at the limit of their capabilities, and that's when they turn to us, and the inn is full.
If you'd like to send thank you cards to the nurses here at OHSU, you can find the address on our website, kptv.com. At OHSU, Drew Marine, Fox 12 Oregon.